Wouldn't it be great that you can avoid knee replacement surgery completely? Wouldn't it be great that you don't need to think about it in the first place if you prevent it by strengthening your knee? Hi, I'm Dr. Sandhya Ravi, founder of Telephysical Solutions Private Limited. I'm into physiotherapy practice for 9+ years and treated around 10,000 patients. And today our topic is how to avoid knee replacement surgery completely. Recently, I see a lot of patients who have been advised with knee replacement surgery. Even then, it is not required during that age or time. So the main reason they go for the surgery is like they have severe pain in their knee. So that is the factor where they ask for surgery also. The first thing is like there are so many things in India. The most thing is like whenever you are having a pain, the first source is like going to a doctor. But in other countries, it's not the same. So whenever the pain is there, basically they go to a physiotherapist. Only when it is not working, the second option is to go to a doctor. So pain is just an effect. So the cause, why it is happening, so that matters a lot. Most of the time, right now, it's everything we are treating the symptom or the effect what we are feeling from the root cause. We have to understand what is the root cause and treating it, that would be the better option. Example, there are so many other ways to avoid knee replacement surgery. So the first thing is like exercising regularly. So whenever you're exercising regularly, that will lead to having a better mobility of your joint, and also like it will keep your lubrication better blood flow, because your joints get blood flow only when you do movements. If you don't do movements just for the reason of pain, most probably after knee pain, you go and take rest. Yeah, 1 or 2 days of rest is fine, but taking rest for a longer period will make the condition worse. It will not make it better. So the first thing is like after 2 days, again you start doing movement. You don't need to go even to the therapist. Your movement will make you heal. So that is basic thing, but we don't do that. We get afraid of pain and we make the condition worse. So one thing is exercising regularly. So the benefit already I have explained it. The second is your weight management. Yeah, most of the knee pain cases you see, they'll be obese. Yeah, their weight will be like more than what according to your height and things. So whenever you're standing, walking, whatever activity, so every pressure of your whole body is and the stress is getting into your knee joint. So during that time, if your weight is also heavy, then it is really difficult part. So make sure that you're managing your weight with right food, regular walking and exercising, all those things. So this is also very common. And sometimes like your arthritis, that is an old age. During your old age, that's a major reason people go for surgery as well. And always I have the doubt, even arthritis would be there in our ancestor time, but I've never seen anyone is going for knee replacement surgery. I have seen people like still 95 years of age sitting in the ground and eating and everything. Then why is now? The major reason I feel is the fear factor. So right now, every way you see after 45 years, calcium deficit is coming. So take this supplement, take that supplement, all these things automatically create a fear factor in your body. So you're already ready. So if I'm 60, I'm ready for knee replacement surgery. So right now I can't, only if I do the surgery. We have seen cases, even doctors suggest you no need for surgery. Patients insist, no, surgery will be the best option. My neighbor said, my that person said, we always go with the suggestions of the neighborhood and our relatives, and we never go with the suggestion of the doctor. Most of the time, it is not that doctor also want you to get into the surgery. Doctor first will ask you to do things which will help you to avoid the surgery. So that is the work of the doctor. But there are people like who insist on doing surgeries and things. And other thing is like sometimes there are so many other medical conditions, your diabetes and other things also will lead you to this. So having your cardio activities, that is like walking, swimming, because whenever you're doing exercise under the water, your weight is completely reduced off the amount. So whenever you're doing these activities, this will improve your strength and also your cardiorespiratory functions, which also helps you to avoid your knee replacement surgery. Like that, you can say that a lot. Initially, I said exercise is not only very low impact exercise, you can do your strength training as well. It depends upon your age and thing. And major is whenever you get pain, go to your therapist or doctor as soon as possible. Don't wait. First, I'll take a painkiller. If it doesn't work, I'll go to your doctor. If it doesn't work, don't go in a very chronic period of time, because most of the conditions are preventable. Even it is not required medicines also. But what we do is we do only in the very advanced. Once we done everything to make the knee suffer, that is where we go to the doctor. That is the biggest mistake we do. To make sure, like, initially whenever you're having your pain, you go it. So by then, example, like if there is a plant, just now it is growing, it is easy to take it off. But if it is grow as a tree, it is not that easy to take out the root. The same thing only. Whenever the pain is in a very initial stage, treating is also very easy, and to make you come out of the problem is also easy. So most of the time we are the reason for making it worse. So make sure to avoid the things which leads to knee replacement. So the first thing is prevention. We always go to doctors for curative. Once we get the pain, to solve it, we go. And basically, physiotherapy is like most of prevention. We will teach you like how that you don't get into that phase. So that is very important. So once you understand that when we have an option not to get it, how would we do things so that we no need to suffer from that? Why we should suffer, then go to a therapist and ask them to help us to come out of it. So the first thing is always easy, no? When we know the way, not to get into that place first. So that is the first thing I'll suggest. So that for everything there is a solution. Only thing is it's about a belief system and going to the right person and going at the right time. So these things are like very important when you're thinking about avoiding knee surgery. So go for a prevention than making a condition worse and getting into a knee replacement. Thank you for watching this video. If you found this video helpful, please share it with your friends or family members who are suffering with knee pain or like conditions they have been suggested by the surgeon to go for knee replacement surgery. So they'll get one more alternative option to try it before trying the surgery. And if you're someone needs telephysiotherapy services from the comfort of your home or office, we are providing that service. So you can visit our website telephysio.in, where you can book our appointments, because we are just one click away. Thank you so much. See you in the next video.